Hello, my name is Stephanie Sanchez, and today we will go over my case study developed for the course Advanced Clinical Procedures. My patient is a 36-year-old Armenian female who is currently not working. She is a stay-at-home mom and has no social life. This patient lives with her husband and daughter in a one-bedroom apartment. Her economic status is low income, and her highest degree of education is an AA degree in allied health. My patient presents with hypertensive cardiovascular disease and is currently in a domestic violence relationship. Special consideration is hemianopia, which is blindness over half the field of vision. She is allergic to codeine. Her vitals were the blood pressure 142/82. Her pulse rate was 94, respiration rate 19, and temperature 99.5 Fahrenheit. She is considered an ASA 2. Surgeries she's had in the past is a cesarean section. She has been hospitalized for treatment for a broken nose and ribs. Medication started due to disease onset is metoprolol and benazepril. Major medical treatment procedures related to the disease is frequent blood testing due to the medication. Medical emergencies, preparedness for possible emergencies is if patient presents with chest pain. My patient is currently on 2 medications. One of them is metoprolol, which she is directed to take 100 milligrams orally in 1 or 2 divided doses. Special consideration when taking this medication is to take with a meal or just after a meal, preferably at the same time each day. Metoprolol may impair the patient's thinking or reaction. Drinking can increase certain side effects. Some contraindications of this medication: we advise the patient who have serious heart problems, heart block, sick sinus syndrome, slow heart rate, not to take this medication, or if you have severe circulation problems, severe heart failure, or history of slow heartbeats that cause fainting. Oral effects of this medication is xerostomia. Some rare side effects are sores, ulcers, or white spots on the lips or in the mouth, and unpleasant breath odor. The second medication my patient is on is benazepril. She is directed to take this 5 milligrams orally once a day. Special considerations when taking this medication is to drink plenty of water each day while on this medication. Contraindications of this medication: patients should not use this medication if they are allergic to benazepril or to any other ACE inhibitors. If patient has diabetes, do not use benazepril together with any medication that contains alescarin. Avoid taking benazepril with alescarin if you have kidney disease. Oral effects of this medication may be dry cough. The following is what we found through the extraoral and intraoral examinations. Face, head, and neck had cuts and lacerations on the face and neck. Lymph nodes, swollen bilateral palpation of the supraclavicular lymph nodes. TMJ, no significant findings. Lips, lesion on lips. Mucosa and alveolar ridge were moist, pink, and bilateral linea alba. In the palate, there is palatal petechiae. Tongue was lightly coated. Floor of the mouth, the lingual frenum was torn. The biofilm levels: calculus, moderate, generalized, and heavy between 22 to 27. Plaque was light and localized around implant on 18 and 31. Stain, discolored teeth from past traumatic injury. Bleeding, generalized bleeding on probe. The occlusion for molar right and left and canine right and left is class 1. Dental charting, probing depths generalized 46 millimeters with localized 7 millimeter pocket depths. The CAL is localized 4 millimeters. Recession, localized on 22, 26, and 27. Restorative work, implant on 18 and 31. There are no missing teeth. Caries on occlusal of number 3, occlusal number 19, occlusal of number 21, and 30 buccal. Fractured teeth are present on number 8, mesioincisal facial, and number 9, mesioincisal facial. Herpetic lesion on lips is present. The gingival color appears generalized red with a distribution to the margin, papillae, and diffuse indentation. Severity is moderate. The gingival contour is generalized, rolled between 23 and 26, and flattened between 7 to 11, with distribution marginal and papillary throughout the dentition and moderate to severity. Gingival consistency shows moderate alteration with marginal edematous generalized throughout the dentition. Gingival texture, the distribution of the texture is generalized, diffuse, papillary, and marginal being smooth with loss of stippling with moderate severity. The color of the gingiva appears generalized red with the distribution to the margin, papillae, and diffuse indentation. Severity is moderate. The contour is generalized, rolled between 23 to 26, and flattened between 7 to 11 with distribution marginal and papillary throughout the dentition and moderate to severity. Gingival consistency shows moderate alteration with marginal edematous generalized throughout the dentition. The distribution of the texture is generalized, diffused, papillary, and marginal being smooth with loss of stippling with moderate to severity. As you can see on these gingival images, there is a 7 millimeter probe index, bleeding out probe with bulbous papillae and rolled margins. Bifurcation is present. Recession is also present. There is a flattened papillae and generalized diffuse red gingiva, and bleeding gingiva, which is also bulbous. As you can see here, the patient presents with generalized moderate periodontitis, which consists of 4 to 6 millimeter pockets, and also localized severe periodontitis, which consists of 7 millimeter pockets. There's generalized bleeding on probe. There's a class 2 furcation on tooth number 2 and number 32, and a class 3 furcation on tooth number 16 and number 17. Patient presents with generalized bleeding and inflammation due to gingivitis. Patient has generalized moderate periodontitis with 4 to 6 millimeters on probe and localized recession on tooth number 22, 26, and 27. Localized severe periodontitis is present in the posterior with probing of 7 millimeters. Radiographic findings support that the alveolar bone to be below the CAJ with horizontal and vertical bone loss. Patient also presents with a class 2 furcation on tooth number 2 and 32 and a class 3 furcation on number 16 and 17. This patient presents with plaque-induced gingivitis due to inadequate removal of biofilm and also plaque-induced gingivitis due to their systemic disease. They have a chronic periodontitis generalized 78.1% with moderate severity. Periosystemic is a systemic disease of hypertension, and period deformity or condition, there is a furcation class 2 on tooth number 2 and number 32, and furcation class 3 on tooth number 16 and 17. The ADA classification for this patient is generalized class 3 moderate periodontitis with localized class 4 severe periodontitis. Patient has fair to poor prognosis due to the bone loss and the class 2 and 3 furcation. Short-term goals for the patient is to improve in their oral hygiene habits and to rinse with Perio Med for however long the dentist recommends. Short-term goals for clinician is to go over the treatment plan, scaling and root planing, eliminate gingivitis, arrest progression of periodontal disease, and subgingival irrigation. Long-term goals for the patient is compliance with new oral hygiene instructions recommended, such as brushing twice, using Perio Med, and flossing. Long-term goals for the clinician is full mouth probe to document any changes, if any, reiterate proper oral hygiene instructions at every appointment, and 3-month Perio maintenance recall. Modifiable factors are oral hygiene instructions, gingivitis, bleeding, inflammation, and calculus. Non-modifiable factors are bone loss, furcation, and recession. The type of examination performed was comprehensive. Some dental findings or oral conditions that were found was that she had moderate to generalized calculus, light localized plaque, discolored teeth from past traumatic injury, generalized BOP, lesion on lips, and her lingual frenum was torn. Types of preventive and therapeutic treatment performed: hand scaled and cabochon on the full mouth, rubber cup polishing, 3% bupivacaine of local anesthetic was administered. A full mouth series of radiographs were taken digitally. Full mouth probe, 5% fluoride varnish, and chlorhexidine gluconate oral rinse was administered at each appointment. For the first appointment, we reviewed her medical history. Vitals were taken, which her blood pressure was 142/82, respiratory was 19, and her pulse was 94, temperature 99.5 degrees Fahrenheit. Pre-rinse was given with chlorhexidine. A comprehensive exam was taken. Extraoral and intraoral exam performed. Patient had cuts and laceration on face and neck due to domestic violence with her husband. Patient did not want to go into further details. A full mouth series of radiographs were taken digitally. Dental charted and full mouth probe. Patient had generalized bleeding on probe and generalized 46 millimeter pockets with localized 7 millimeter pockets. Her lingual frenum was torn and she has fractures on number 8, mesial incisal-facial, and number 9, mesial incisal-facial. Patient had a doctor exam with Dr. X. Dr. X recommended fillings for caries on number 3 occlusal, 19 occlusal, 21 occlusal, and 30 buccal, and to have restorative work done for tooth number 8 and 9. We took an impression for a study model. We also took intraoral pictures. Her plaque index was 29%, so we set a goal for 10%. We went over oral hygiene instructions. I demonstrated to the patient the best technique for brushing, how to use the end-tuft brush around her implants, and how to properly floss. I had the patient demo back. We reviewed her treatment plan. I dispensed food diary for nutritional analysis. Her next visit, we will begin scaling and root planing in the upper right quadrant and subgingival irrigation. For appointment number 2, we reviewed her medical history. Her vitals were taken. Blood pressure was 146/84. Respiratory was 14. Pulse was 72. Temperature 98.2 degrees Fahrenheit. I collected the food diary from the patient. Pre-rinse was given with chlorhexidine. I disclosed her and her plaque index score was 20%, so our goal is 10%. reinforced oral hygiene. Topical anesthetic of 20% benzocaine was applied to the injection site for 1 minute. Injection was ASA, MSA, and PSA on the upper right quadrant with 1 carpule of 3% bupivacaine was administered. 1 cartridge of Oracake supplied lingually. Icavitron the upper right quad, fine scaled and root plane. Dr. X performed restorations on number 3 and number 8 with composite resin. Subgingival irrigated with chlorhexidine on the upper right quad. Patient responded well to the local anesthetics. The post-op instruction is to avoid chewing on the right side until the anesthesia wears off. Told patient if she's feeling sore, she can take Advil, Tylenol, or whatever it is that she can take, or she can rinse with warm water and salt. For her next visit, we will do scaling and root planing in the lower right, subgingival irrigation, and nutritional counseling. For the third appointment, I reviewed the medical history. Vitals were taken. Her blood pressure was 140/85, respiratory 16, pulse 82, temperature 98.9 degrees Fahrenheit. Pre-rinse given with chlorhexidine. Plaque index of 18%, which our goal still remains at 10%. Praise the patient on the improvement she is accomplishing. Reinforced oral hygiene instruction. Nutritional counseling, which explained the food pyramid compared to the patient's food diary. Evaluated and explained sweets with total daily minutes of acid attack form. Gave document on eating healthy and hypertension. Topical anesthetic of 20% benzocaine applied to injection site for 1 minute. 1 carpule of 3% bupivacaine administered to IA, the LB, and MI on the lower right quad. Cavitron, the lower right quad, fine scaled, and root plane. Dr. X performed restoration on number 30 buccal with composite resin. Subgingival irrigated the upper right and lower right with chlorhexidine. Patient responded well to local anesthetic. Post-op instruction is to avoid chewing on the right side until anesthesia wears off. Told patient if she's feeling sore, she may take Advil or Tylenol, or she can rinse with warm water and salt. Next visit is scaling and root planing, the upper left quad, and subgingival irrigation. For appointment 4, I reviewed medical history. Vitals were taken. Her blood pressure was 140/80, respiratory 15, pulse 78, temperature 97.8 degrees Fahrenheit. Pre-rinse was given with chlorhexidine. I disclosed her and her plaque index was 15%. Her goal still remains at 10%. Let patient know she is still improving. Reinforced OHI. Topical anesthetic of 20% benzocaine was applied to the injection site for 1 minute. Injection ASA, MSA, PSA on the upper left quadrant with 1 carpule of 3% bupivacaine was administered. 1 cartridge of Oracake was applied lingually. Cavitron the upper left quad, fine scaled and root plane. Dr. X performed restoration on number 9 with composite resin. Subgingival irrigation with chlorhexidine on upper right, lower right, and upper left quadrant. Patient responded well to the local anesthetic. Post-op instruction is to avoid chewing on the left side until anesthesia wears off. If patient feels sore, advise her to take Advil or Tylenol or rinse with warm water and salt. Next visit is to do scaling and root planing in the lower left quadrant and subgingival irrigation. For the 5th appointment, I reviewed her medical history. Vitals were taken. Blood pressure 145/88, respiratory 17, pulse 87, temperature 99.1 degrees Fahrenheit. Pre-rinse given with chlorhexidine. I disclosed her, which resulted in a 12% plaque index. The goal still remains at 10%. It's a really great improvement since her first visit. Reinforced oral hygiene instructions, 20% Benzocaine was applied to the injection site for 1 minute. 1 carpule of 3% bupivacaine was administered to the injection site of the IA, LB, and MI on the lower left quadrant. Icavitron, her lower left quadrant, fine scaled and root plane. Dr. X performed restorations on number 19 and 21 with composite resin. Subgingival irrigated with chlorhexidine on her upper right, upper left, and lower left quadrant. Patient responded well to the local anesthetic. Post-op instruction is to avoid chewing on the left side until anesthesia wears off. If patient is feeling sore, I advise her to take Advil or Tylenol or rinse with warm water and salt. Next visit is in 6 weeks for evaluation. Full mouth probe, fine scale all quads, polish, floss, and apply a fluoride treatment. For the 5th appointment, I reviewed her medical history. Some home care recommendations for the patient is to use Paravan for however long the dentist recommends, and then we can switch back to the oral rinses that are listed below. Temperature
Some over-the-counter dental aids are N-Tough brush for implants and Biotin alcohol-free to rinse for 30 seconds, spit it out, and use whenever needed.
The goal still
Do not
remains
use no
at
more
10%.
than 5 times
It's a really
a day.
great improvement since her first
Toothbrushing we
visit.
recommend for a power
We
toothbrush,
enforced
but
oral
because
hygiene
patient can't afford it,
instructions.
I recommended for her to
20%
use a soft bristle
benzocaine
brush
was applied to
and
the
to use the back
injection site
technique.
for 1
Brush
minute.
for 2 minutes,
1
twice a day
carpule
at
of
a
3%
45-degree
bupivacaine was
angle.
administered
Toothpaste
to the injection
type
site of the
Sensodyne
IA,
True White,
LB,
used twice
and
daily.
MI on the lower left quadrant.
Floss, Oral
Icavitron,
B
her lower
Glide Pro
left
Health for
quadrant,
tight contacts.
fine
When
scaled
flossing,
and root
seesaw
plane.
down to the gingiva,
Dr. X
cup the
performed
floss to a
restorations
C-shaped around the tooth
on
and
number
go up 2
19
to 3
and
times all around
21
the
with
dentition.
composite resin.
Mouth
Subgingival
rinses,
irrigated with
the
chlorhexidine
patient can also
on
use
her
as
upper
Listerine
right,
Zero.
lower right,
She
upper left,
will
and
rinse
lower left
full
quadrant.
strength for
Patient
30
responded well
seconds
to the
with
local
20
anesthetic.
milliliters, which is 2/3
Post-op
fluid ounce
instruction
for
is to
4
avoid chewing on the left
teaspoonfuls,
side until
morning
anesthesia
and
wears
night,
off.
and do not swallow.
If patient is feeling sore, I advise her to take Advil or Tylenol.
This nutritional
or rinse with
analysis
warm
is
water and
recommended
salt.
for the patient due to
Next
her
visit
hypertensive
is in 6
cardiovascular
weeks for
disease.
evaluation. Full mouth probe.
Things she should add
fine
to her
scale all
diet are
quads,
lean protein,
polish,
whole grains,
floss,
low-fat
and apply a
dairy,
fluoride treatment.
fruits and vegetables. For the
What she
5th
should
appointment,
omit from her
I reviewed
diet
her medical
are canned
history.
soup,
Vitals were
deli meat,
taken,
and sugar.
blood pressure
And
145
things she
over
should avoid
88,
in her diet are
respiratory
salt,
17,
packaged food,
pulse 87,
fast food,
temperature
and alcohol.
99.1 degrees
Some
Fahrenheit.
supplements she can also
Pre-rinse
take
given
are
with
magnesium,
chlorhexidine.
250
I disclosed
milligrams,
her, which resulted
iron,
in a
65
12%
milligrams,
plaque index.
and vitamin
The goal
E,
still remains at
400
10%.
IU. It's a really